Vanakkam. The hand, as you all know, is such an important organ. Imagine if it gets injured. It just does not move or it cannot work at all. Your earning capacity is gone. You can't go and do any work. Sometimes it is so bad that you can't even brush your teeth. You can't do your own work. So, when there is an injury to the hand, it is very important that it gets back to function. So there are two things. One is form, the second is function. For instance, if the thumb is cut off completely, we can put it back with surgery. But just putting it back with surgery is not enough because it has to move. Only if the thumb moves, it will be useful to the hand, to the patient also. So here, there are two things involved. One is form and function. The person who is going to give the form and concentrate on that is the surgeon. But that is not enough because function also must come back. And to provide that function, the therapist comes in. Without therapy, and when I say therapy, there are so many things. It is not only mobilization. People think that physiotherapy is only moving the fingers. There are so many other things. There are prosthetists who are involved, orthotists who are involved, occupational therapists who are involved. If I am doing a particular work and I have an injury to my hand, the occupational therapist will be able to know what my job is, how my actions will be, and help me towards getting that goal. For instance, if I am a clerk in a bank or something and my hand is injured, my main thing is I must start writing with that hand and the fingers. If my fingers are lost in the accident, still I can be made to write because that is my livelihood. The occupational therapist here comes and tells me, gives me some adjustments and tells me how I can restart writing with that hand. So, without the role of therapy, the hand becomes again useless in spite of wonderful surgery. So it is always hand in hand between the surgeon and the therapist to get back a functioning hand for the patient. There is one problem here. The important thing is the surgeon must tell the patient that therapy is very, very important. Only then the patient can go and follow up with the therapist. The surgeon may see the patient for a maximum of 5 minutes or 10 minutes in a day, but the therapist will see the patient for more than half an hour or more than 1 hour sometimes. And the surgery may take about 3 to 4 hours maximum, but the therapy will go on for 6 months, sometimes even 1 year. So the patient has to be, along with the therapist, work on the hand and do as the therapist feels so that good function can be achieved. And a therapist must be able to communicate with the patient what is required. And then, only when this communication between the surgeon and the patient and the therapist, and the surgeon and the therapist is completed, we can get back a functional hand. This conclave that is being conducted is exactly this. There are three things that are being that are being addressed in this conclave. The first is the health, good health, that is a good functioning hand. The second is collaboration between the therapist, the surgeon and the patient. And the third is teaching of concepts so that everybody can understand what is needed, what the surgeon needs from the therapist, what the therapist wants from the patient. So all this can be understood only when we have a conclave like this, where everybody gets together and understands. After all, we are all working for the single person who is the patient, and we are all working to get that hand moving. Okay?
So the kids, intellectuals.
One more interaction. Yeah, ask question. Oh, sorry, I do introduction. I am Dr. Karthikeyan. I am a plastic surgeon and specially interested in hand surgery. Lot of people have asked me who all do hand surgery. Plastic surgeons do hand surgery,
Some orthopedic surgeons do hand surgery, and nowadays there are specialists, that is, surgeons who are specialized in hand surgery alone. So all these people do hand surgery. The most important thing is having an interest in doing hand surgery. It is not just doing a procedure or a surgery on the hand, but it is also following up the patient till the patient is able to use that hand for his day-to-day activities. Vanakkam.